Th Thank you for the introduction, and I'm very much delighted to be here to talk with you today. Um, I have to say, before I went back to USC, I was here in Washington. I spent 3 years working at HUD in the Office of Policy Development and Research, uh, talking and trying to get a lot of the things that you guys have been talking about moving. And I will say that I do believe there has been progress made, and I'm pleased to see that others are trying to make even more progress. I have to say also I'm pleased to be here because I wasn't sure I was going to be here. I got called for jury duty on Monday and wasn't clear that I was going to get off. But I did. So part of the reason why the structure of this panel is the way it is was because there was some likelihood I was going to be Skyped in from a big screen and they didn't know how it was going to work. So that's why we are how we are. Now, I have not been party to all the discussions that you've had on this issue through the roundtables convenings. And so it was actually pretty interesting and useful for me to come early and get to hear some of the thoughts and perspectives. And so I'll take my license as the presenter to give my thoughts on some of those things. The first is I do think that if we're going to be successful and effective in this space, there's going to be an important role for evidence basis for making policy and work that is done to try to create the conventional wisdom and the stylized facts about what works and what doesn't is going to be critical if you're going to build consensus around what sorts of policies need to be put in place. And so the conversation earlier, I think Jeffrey Levy was talking about early childhood investments and the willingness to invest there. That comes out of evidence, right? And the existence of a body such that we can all agree that these are good investments. You see the same thing in the homelessness area. We've had a number of budget issues here in Washington in the last couple of years. Homelessness has not been one of the areas that has faced those same sorts of constraints, and it's precisely because there's a broad understanding about the benefits of investing in prevention of homelessness that leads to significant savings on the backside. It's exactly those sorts of things that we'll need to see if we're going to see this sort of discussion be brought to scale in a policy space, and that will be very important. The federal government is actually trying to do this, and there have been a number of initiatives in the Obama administration aimed at trying to get coordination across agencies such that monies can be spent in a coordinated and leveraged way. And so I would encourage you all to, I'll talk about a couple of those, but it is important to know that the structures that are set here in Washington at the federal government level do provide guidance for locals in terms of how they structure themselves, and we're starting to see that as well. I want to also say that this session is actually a really interesting session for me because you're focused a lot on resources and innovation, but at the end of the day, you also need to have changes in the rules of the game. And so this is really a top-down issue. The rules need to change, but it also needs to be a bottom-up issue so that we know which rules need to be changed and how. And so there needs to be voice in both of those areas, and so this is actually really important to be mindful of all the different roles that need to be played, and roundtables like this can have a voice in both of them and really be an important link to make sure that those messages and those lessons are communicated in an effective way. I would also say that there are resources and investments that are going on in other areas. So at HUD, Kevin showed some maps earlier today about vulnerable populations. HUD, we actually have very similar maps. We should actually have a conversation about what's the right vulnerable population, or what are the sets of vulnerable populations, and how do we ensure that we're using the same definitions. I was struck in my time at HUD that a youth was like 17 different things, right, depending on which program and which agency you were talking about. And it makes it difficult to be efficient with your use of funds if everyone's looking at a slightly different population. So there, I think, is value in trying to think about where are we facing common conceptions of the problem and make sure that we actually define it the same way so that we can move forward. And then the last thing I wanted to say is that you all have my slides in your packet, and I'm notoriously bad about changing them after I hand them in. So my class, when I teach classes, they always complain because that slide wasn't in the thing that you uploaded. So I resisted that urge today. The slides you have are the slides that you will see, but I will add some things in various points as we move forward. So what I wanted to do today is actually three things. I wanted to talk a little bit about where we've come in the context of policy and its relationship to population health, because that history, I think, is important. I started doing this in my class in affordable housing development, just so that my students know that the reason things are the way they are today are good reasons or legitimate reasons, and that history will also shape where we can go in the future. So I want to talk a little bit about that. The history I talk about for my students in affordable housing policy and housing policy in general is designed more to shock them because there are challenges and difficulties that I don't think that they really appreciate ever existed in this country. But here I think there's a different message, and I'll get to that in a second. Then I want to talk a bit about the what. So what vehicles are available and what resources are available to be leveraged in the pursuit of improved population health. And this happens in a lot of different areas, and community development is actually a pretty broad field. It touches a lot of different disciplines, and so that means there are lots of different programs, lots of different opportunities to find resources to piggyback into the things that we do in a healthcare setting. And then I want to talk about the how, because right now I work at my center at USC is the Bedrosian Center on Governance, and I'm an economist by training. So we don't really do governance. We do incentives, design programs, figure all that stuff out. But my time here has sort of made it very clear that if you don't have coherent governance, it doesn't matter what the program design is. It's not going to work. And so we need to be mindful about how we go about doing this and what things need to be in place, or what things we need to be thinking about as we're designing our programs and as we move forward to make sure that we maximize effectiveness. And this is the hard part. I think the how is actually harder than the what in a lot of regards. In the last panel, there was a conversation about San Francisco's effective use of resources and programs. They're trying to do exactly what they did in San Francisco around homelessness and housing investment in Los Angeles. And they're finding it to be incredibly difficult. And the reason it's difficult, at least the reason I think it's difficult, is that in San Francisco, the county and the city are coterminous. They have exactly the same boundaries. So the savings are all realized internally. They don't have to go across jurisdiction. They don't have to do any of that sort of stuff. The contracts, the implicit contracts, are actually explicit because the same people who write the rules. In Los Angeles, LA, the city, is one jurisdiction of 89 in LA County, right? And so if the savings accrue to the county and they're going to be city investments, what guarantee does the city have that they're ever going to see those savings? And if the answer is none, then you're not going to have a program, right? And so you have to think about the governance structure and how that plays out to make sure that, that things are feasible and your design actually fits the situation on the ground. All right, so that's probably a lengthier introduction than I thought I was going to do. But I want to talk a little bit about history. And I should do the punchline because I always tell my students, you tell them what you're going to say, then you say it and tell them again. So the punchline here is that I actually am optimistic. I actually think that there is an opportunity for proactive behavior and actually getting out in front of these issues and thinking about how do you build your partnerships, how do you create opportunities to make progress on social determinants of health and wind up improving our population health. This isn't going to happen overnight, but I do think that there are signs and examples of this all over the country. You're going to hear about a couple of them through the rest of today. And we just need to be, I think, particularly sensitive to the fact that it takes proactive action, right? This is stuff that you have to think about, you have to plan, you have to anticipate, you have to design. And so that thought is going to be important. That's something that was implicit in everything that we've heard so far today, right? None of those programs happened, they just kind of evolved. There was a lot of thought that went in. There were lots of decisions that were made about which things we were going to look at, which things we were not going to focus on. That is going to be a feature of anything that's going to be successful here. And it can ultimately result in the development of general models, I believe. I don't think we know what those models are, but I think there is the potential to develop general models of how do we create these structures to bring this to scale and then to see actual movement in outcomes. All right, so the history. Community development and population health actually have a very long history. So if you think about housing policy in the United States, there actually wasn't any housing policy in the United States until the turn of the century, the turn of the 1900s. And it really emerged out of slums that came out of the Industrial Revolution. If you've seen the movie Gangs of New York, right? All of that bad, nasty stuff was real, right? And it led to all these health challenges and difficulties that caused public health officials, the advocates of public health, to say, we need to do something about the quality of housing in these places. We either need to get rid of the housing or we need to fix it up. And so a lot of building standards have evolved, and all this happened largely locally. So we see these examples have some records of very poor housing and the conditions that people were living in. These are two pictures of places where people actually were living in those structures, right? So it was pretty rough. And then I like this one because the picture on the left, that was the landlord's apartment, right? So this was not some notion that there was the 1% and then everybody else. Just about everyone in these communities was living in very difficult, unsanitary, and unpleasant conditions. You can read this. This usually turns the stomach of most people. We don't allow these things to happen anymore. But those kind of conditions were really the drivers for housing policy and basically neighborhood and urban development policy in the United States. And the reason I do this to shock my students, you know, they were all born in 1990 something, and so they have no idea that this is actually going on, or it went on. But for this group, I think it is important to just remember this because we don't have this problem anymore, right? We actually have had successes in having investments in other areas lead to positive changes in public and population health, right? So this can be done. It has been done in this country. This didn't happen overnight either. So these pictures were in the 1890s and 1900s. By 1970, we were in a place where most housing was of pretty high quality, and we didn't have these issues. So that's 80, 90 years. But it can be done, and it has been done, and that's something that I think we should all just be mindful of. Now, when we think about economic development and community development policy today, it's actually quite different than it was in those days, right? And it was different because of how policy evolved. The National Housing Act of 1949 was the first really, really big housing act that was ambitious in terms of the federal government was getting into housing policy, but the federal government got into housing policy in a very specific way. They cleared a lot of slums, they did some things to help home ownership, and then they started public housing. And the way they designed public housing, it was designed as a safety net. It was not designed to try to change communities more broadly, and it was certainly not designed with the notion of population health in mind. It was really viewed in a very different way, and this really marked a divergence in terms of housing and urban policy and the health policy that we really is created a divide that we still struggle to come across. But we have a common origin, and it is something that I think should be kept in mind. Now, despite that divide, there has been progress that's been made in a number of areas. So lead paint is one area. I think Someone mentioned that in the last session, that we have basically eliminated the issue of lead paint for children. This is a remarkable achievement, and this happened relatively quickly. Right? So 15, 20 years was all that it took to make that progress. And so we've seen significant changes, but it hasn't been holistic. There hasn't been some notion that these things should always be thought of or always be considered when we think about the relationship between policies in one area and policies in in the health arena. And so what we're trying to do now is reset, right? I think you guys have said you've had this conversation for 20 years, maybe this is an extended reset, but it is something that that I think needs to be done, and it's something that I think people in my area, right, in the housing and economic and urban development area, have become increasingly sensitive to, right? And I think there are at least 3 reasons. I've listed 3 here. The first is that we've been trying to do things to improve housing policy, housing in urban neighborhoods. And what we found is that in some of our biggest demonstrations, the biggest effects have been health effects, right? So if you think about Moving to Opportunity, which is a program where we gave families, low-income families, an opportunity to a voucher that allowed them to move out of concentrated poverty neighborhoods to other neighborhoods, the biggest benefits we saw were on the health side. Lower stress, less obesity, reduced incidence of diabetes, fewer mental issues. Right? Those are all health issues. Right? And so that was a wake-up call. When they started the demonstration, health wasn't even on the radar screen, but it did lead people to start to think that, well, maybe these things actually do have these other benefits, and we should think about what we do in a broader way. The second is that the notion of social determinants of health is something that has become much more commonly spoken of in our arena, and I think more broadly. So, so people don't start looking at you quizzically when you say, well, we do health too. They kind of understand that. And then the third, which is really important, is that it's where the money is, right? So everyone is looking for money, and you guys don't do housing and urban policy. We have the least amount of money. So we're always looking for everywhere else to find out where there's any kind of money and trying to find ways to leverage that. And so there are lots of different reasons why we're here. And then now I want to talk a little bit about the what, right? So what are the types of programs that are out there that you might leverage? And they span a number of different areas. I've shown here also some estimates of how much is spent in these areas. And what I would say is almost none of the money that's spent in these areas is purposefully linked to health in any way. Right? It's not because they're antagonistic to health, they just really haven't thought of it. So there's potential in all of these areas, and for, I think, just about every dollar that I'm going to show here, for there to be a health benefit that's brought to it. And what it will require is creativity and some energy. So housing and community development, there are a number of programs here that covers about $30 billion annually. I just put this slide in because I'm terrible with technology and I got the things to work, so it looked good. So it just shows you that there are all the different ways that, thank you. There are all the different ways that housing can improve people's outcomes. Right? We talk about housing as a platform for improving people's lives, schools, jobs, healthcare for both youth and the elderly. These are critical things in terms of aging in place. All right, there's public safety. So the Justice Department has a number of programs that are community-based, and these community-based changes can make places safer, have people be calmer, more secure in their home, have better health outcomes as well. There's transportation. So everyone here has heard about sustainable communities, sustainable neighborhoods. Transportation investments are the main vehicle by this, and there's a lot of money in transportation as well. There's capital and finance, the Treasury Department and others. Someone mentioned the Community Reinvestment Act earlier that banks are sensitive to. These are all programs where flows of capital can be invested in communities and neighborhoods. And I would say also, most of these programs are pretty flexible in terms of what you can use the money for. So CDBG, which is a HUD program, The eligible uses are extremely broad and extremely open. It's just which target population you're looking at. And since we've already decided we're going to figure that out, we can pick one that fits for this, and then we're good to go. Right? There are lots of different things that you can do in this regard. CRA is the same way. And so this is a program that HUD, along with actually the Ashoka Changemakers, did a competition to find new policies or programs, and it's international, to improve sustainability in communities. So this is the example, or I put this in as an example to show there are interesting partnerships that you can develop to try to get ideas out there and to really let people think creatively about, well, what's the possible? And can those things work in our neighborhoods? Then the education department also has a number of programs that are important for healthcare, right? And I'm actually doing some research on school-based health clinics, which is a partnership that is becoming more and more common between the education department and healthcare systems. There's very little evidence about what they actually mean for either educational outcomes or the health of the students. But if that evidence can be developed, we're working in San Diego. They are looking to find ways to expand investments in those sorts of clinics if that evidence is present. So there is really an opportunity to make a difference here in these regards. Someone, I think in the last panel, there was the project in Memphis. The federal government has declared Memphis one of its strong cities, strong community cities. And so that comes with a whole host of money. And I'm wondering, I don't know, whether there have been communications with the SC2 people and your program, because that may be an opportunity to build some partnerships to advance things. All right, so this is the Jerry Maguire, we got to find the money, right? And this is going to become ever more important. The programs that I listed, that's about $100 billion annually. So that's like real money, right? And you can actually start to see things if that gets leveraged in effective ways to make positive change. It is a real motivation. This is the resources panel, and I think it is. Where are the resources? Like, what sorts of things are available out there? This is a partial list. There's a lot more that can go on. All right, and so what I wanted to do is talk a bit about the how. And if we're going to do this effectively in terms of integrating community development and population health, it's going to have multi-sectoral elements, and it'll be multidisciplinary. It'll be multidisciplinary pretty much by definition, right? You guys are health guys, warehousing guys, you got urban guys, you got the public safety people. If we're all going to sit in a room together, we're going to bring different levels of expertise to the table. We are going to have to find common language. Right? So one of the challenges that I've seen in these sorts of meetings is that everyone calls the same thing something different, and it has slightly different meanings and implications, and it's hard to sort of all settle into the same place. So finding that commonality of language, a common way to communicate, will be particularly important. In terms of the multi-sectoral notion of this, there are, at our school, we talk about public-private partnerships all the time. This is probably even too narrow a conception of what kind of partnerships are possible. Philanthropy is important. The private sector is important. So one of the things that was very interesting was 2 days ago, or was it yesterday? CVS announced that they're not doing the tobacco products in their stores anymore. That's interesting, right? That's a private sector effective investment in population health, and it should make us all step back and think, well, who else is out here who is thinking about this stuff that we should be engaging and talking with? Because those sorts of investments, that's going to be a lot of money that CVS is foregoing. And if they're willing to take those sorts of steps, that would suggest that there are lots of resources that are available to be leveraged in this way. So that's going to be really important. The other thing that's going to be important is just figuring out who these people are. right? So if you want to partner with someone in transportation, you actually need to know who the transportation planners are. You need to know what their calendars are, what their schedules are, when grants are awarded. And those are things that people don't know unless you're in transportation, right? So it will require a lot of extra effort to be effective in creating these partnerships and building these opportunities to work together. At HUD, we span a lot of this stuff, and even inside our building, we don't know, right? So getting outside the building and trying to figure this out will require some focus and energy. This is done in a couple places. One thing I will say, there are some burgeoning programs that are being developed. So CDC, I know one of your members is a CDC member, has the Health Impact Assessment. That's actually an interesting potential vehicle to get in front of people who you wouldn't ordinarily get in front of to talk about health issues. And then in Los Angeles, we have a plan for a healthy LA. And that's another thing where the mayor and foundations together are driving conversations about health in communities, and that's important. Okay, so this red thing is blinking, so I need to stop talking. But I just wanted to close with two quotes. The first is, a crisis is a terrible thing to waste. We know that in many of our neighborhoods of concentrated poverty, population health is pretty poor, right? There is a crisis going on in our communities, and we should be doing things to try to improve it. And the more we get awareness of that into the public domain, the more likely it is we have a potential to galvanize resources to be effective in improving those things. And the second quote is a quote, it's maybe my favorite quote of the decade. So I heard Bill Clinton talk, and he's very interesting. If you ever get a chance to talk to him, regardless of whether you like his politics or not, he always says interesting things. And this was interesting, right? So too often people will be stuck in ideology or their own space and want the world to be a certain way. Well, that's actually not helpful if the world isn't that way, right? So you're better off figuring out how the world is and then trying to work with it in that context. And so we need to harness those realities and those structures. But then the last thing I want to say is that it is important to have vision on this, have some clarity on where it is we are trying to get to, what are the outcomes, what are the processes, what are the metrics, right? Because with that vision that allows you to build a narrative, and that narrative is the thing you will take to build allies and partners that allow you to make change, right? And so, so I will stop there. My two colleagues after lunch will start to tell you about some of their narratives and how they've been effective in building those visions. But this is very exciting for me, and I wish you guys the best of luck, and I hope this has been helpful and we can do more together. So thank you.
Thank you, Dr. Bostic, and I want to thank you also for sharing that lovely multi-purpose sync story at the beginning of your talk rather than at the end. So not that I just reminded you all of it, but at this point we're going to break for lunch. There'll be a chance to talk with Dr. Bostic after the other panelists have presented again after lunch, and Dr. Montero will take us into the rest of the second panel, but we'd like to reconvene a little bit before 1 as we did between the other break so that we're all seated and ready to go, and lunch is available outside. Thank you.